Hey everyone. Um, briefly, I want to talk about mental health and sleep, right? So, there is a connection, there is a relationship between mental health and sleep. And whenever you have poor sleep hygiene, it can really impact your mental health in a negative way. Now, there are some mental health disorders that disrupt sleep patterns. And so today I just kind of want to talk about some various topics, again, related to mental health and sleep. So, the connection between sleep and mental health and its impact on mental health. So, if you deal with issues with chronic sleep deprivation, it can lead to mental health issues, um, including anxiety, depression, cognitive impairments. Um, Whenever you have poor sleep hygiene, it also impacts your mood regulation. It increases stress, which of course um, exacerbates mental health problems. So the impact on mental health on sleep. So mental health disorders such as like PTSD, depression, anxiety, um, even bipolar disorders can sometimes cause disruption in your sleep. Things like insomnia or hypersomnia, or just like an irregular sleep pattern. So, with insomnia and mental health, insomnia is probably one of the most common sleep disorders, and it's often linked to mental health conditions like anxiety and depression. Some of the symptoms of insomnia, difficulty falling asleep, staying asleep, or either you wake up very early and then you're not able to go back to sleep. And that's something that I dealt with. And so, but it's a lot better now. A lot of people do cognitive behavioral therapy or CBT for insomnia. It has been proven as an effective treatment, as it addresses like the behaviors, like what causes insomnia. Um, I'm not here to advocate or tell you one way or the other which type of therapy is best. I didn't do CBT just for personal reason, but the research does show that that is a effective treatment. So for sleep and depression, so with sleep patterns, depression often leads to changes in your sleep, again, such as insomnia or hypersomnia. Um, if if you don't uh, get some help for poor sleep hygiene, the problems are going to worsen, right? And they're going to make your symptoms worse as far as dealing with depression, and it makes your recovery time, it makes it a little bit more tough. So for treatment, to improve sleep hygiene, some people use medication, they may use melatonin, they may use therapy um, as a way to help manage sleep issues related to depression. And then there's anxiety and sleep. So anxiety can lead to issues with being able to fall asleep or stay asleep or actually just experiencing rest, because there is a difference between rest and sleep. So with anxiety, it's just like a hyped up anticipation, and it just causes you to be so anxious that it really just creates like a vicious cycle that interrupts your sleep. And so for some people, they may practice things like relaxation techniques. Again, they may do the cognitive behavioral therapy, or some people they choose to do medication to help reduce anxiety to help improve their sleep quality. So there are some other things. In fact, I'm going to cover one more. I want to do this in a two-part, but let me cover one more. Sleep and bipolar disorder. And yes, there is bipolar 1 and bipolar 2. So some people with bipolar disorder, they often experience issues with disturbance in their sleep when they may be having a manic episode or depressive episode. So when they may be dealing with mania, they may have a reduced need for sleep. And when they're dealing with depression, they may struggle with insomnia or hypersomnia. So for some people who have issues with they've been diagnosed with bipolar disorder and they have issues with sleep. Um, some people, in order to establish a good, healthy sleep pattern or sleep hygiene, they create a regular sleep schedule and they stick to it by the book, and that kind of helps them address issues um, as well in their therapy sessions. um, and some even use medication too, or a lot of people that I've had personal experience with working in mental health. They use medication to help them manage their bipolar disorder symptoms. So again, that regular sleep schedule and almost like keeping a journal too kind of helps them whenever they're able to talk to their therapist. They can kind of maybe uh, pinpoint um, where the sleep disturbance began. All right, so again, I'm going to do a part two. So I will be back and I will cover PTSD and sleep. I'll probably talk about the role of a good sleep hygiene and mental health. And I'll probably give some different apps that you can use at night, like mindfulness apps that kind of help relax you um, as you prepare for bed. All right, peace and blessings, y'all. Take care. Have a good one.